So we added your logo here at the very top, also down here at the bottom as well, along with the Department of Public Health websites, dph.georgia.gov. So I'm just going to take you through the screening questionnaire process. If you guys have any questions, please feel free to ask them as I go along. So the first step is just clicking on the Take Screening Questionnaire question. You're going to have a CAPTCHA just to verify it's a human. So let me go ahead and enter this in. Okay, so this is where we have the first set of questions. So I'm going to enter in my information here. When did my symptoms first begin? And in March, I'm going to select some of the symptoms here. Select a few of the conditions. All right, click next. I'm going to select if I've had a known exposure to someone with COVID-19. I'm going to say no. These are some general situational questions. I'm going to fill in my age. Fill in some of this other information. Okay, everything looks good, so I'm going to go ahead and click next. All right, and the final page on here is the demographic information. So I'm going to go and fill this in.
Hearing some wind noise, if somebody could mute.
We added in all the race options that you guys requested, along with ethnicity as well. And then the last question here is to fill out my date of birth. And then click submit. And then at this point, they'll receive a thank you message on the last page of the portal. And then if I go just to show you where the record is in Dynamics, I'm going to switch over here, refresh my screen, and now you can see here that it was instantly created. And I'm not going to spend a lot of time going through this. I just want to show you guys that a QR code for the unique identifier of the record was generated here. So going back to the interviews, we have two views set up based on the criteria that you guys submitted. We have one for not recommended for testing, and then another one for recommended for testing. So all these records underneath each view are pre-filtered based on that criteria, whether it's at least one symptom and at least one condition, or something else that you guys have listed. So each time you toggle between these views, it's going to display only the records that meet that criteria. There's also a view for all records if you want to see that as well. But for simplification, we just have two views, one for recommended for testing and one for not recommended for testing. All right, so I'm going to show you now how to generate an email for either an approved test or a not approved test. So once you go to your view, in the first example, we're going to go to the recommended for testing, approved for test email scenario. So I could select one record or many. I could select all records in the view, or I could just select the ones I want to. So I'm just going to select this first one here. This is the one I just created. What you're going to do is click on this flow button up here, and then there's two options. One is for sending the approved test email, and then the other one is sending the not approved test email. So let me go ahead and just click on the send approved test email. It's going to give you a confirmation page here. So it's going to apply to one record. If there were 50, it would say apply to 50 records. I'm going to click OK. And there's a process in the background that will be sending out the email automatically. We'll just give it a second. All right, so it's on my other screen, so let me pull that up. So if you guys can see my email, we have in the specific text of saying you've been approved to receive a COVID-19 test. We have the QR code specific to the identifier of that interview record for myself, and then we also have the download of the isolation monitoring procedures that you guys had put in the document. So I'm going to go ahead and show you what the email for a not approved test looks like. So I pre-created this interview record just to save time. So I'm going to go ahead and select this one here.
So if we just were selecting all of them, the process would be the same. Can you just show us how to do multiple ones? If we want to, say we have we come into the queue and there's 1,000 test requests.
Yep. So you would then choose the select all button here, and if there's 1,000, you might need to toggle through each page. I can't recall off the top of my head how many results are per page.
Yep, but it's adjustable. It's defaults to 25 and goes up to 250.
Okay. But yeah, so you can select one or many. So I selected the one. I'm going to choose to not be approved for testing. I'm going to click on the same flow button up here and then choose the send not approved test email. You guys have any questions so far?
What happens to bounced emails? Or do they need to confirm their email address to even get this far?
So it does require that there's an email entered as part of the requirement on the portal. It's not verifying that it's an actual email when this process starts. If that's what you're asking.
Can we at least ask them to confirm their email address and make sure they match?
On the portal itself? That's another question.
Mm-hmm.
Yeah, we could add another question on here that just says, please confirm your email, just to make sure that they had it right the first time.
Okay, and you can match the values to make sure it's correct.
Yes, it's possible.
Yep.
I don't know about having it any more changes by tomorrow, but we'll try to see what if there are things that are must-haves for tomorrow's a pilot for tomorrow. We'll try to see if we can't include them. We kind of might need to rank them depending on how many we get out of this meeting.
Good question, though.
I tell you from, even having the providers put in the requests, we probably have 10% type in the wrong email address. We hadn't had verification, and it's a huge problem. I can only imagine.
So you're going to see, right? You'll see the ones that haven't, that haven't gone to get a test, obviously. And so if you notice that people aren't testing, you could always reach out to them and say,
I'm not going to have the resources to do that. We really need to have some sort of email verification in the system.
Oh, yeah, I got you. I got that point, right? I just wanted to also mention that.
Is there a way that we can control the from address? In other words, could we use our contact public health at dph.ga.gov as the from for the email that goes out in an automated way?
Are you talking about this address up here? Yeah, you can change this. We just need to make sure that there's proper security permissions to make sure that we can connect to database and Outlook, send the emails, etc. But yeah, this could be changed.
Okay.
So yeah, so this is the email for not approved. This is just taken directly from what you guys have requested. I'm just saying they're not qualified for testing. And then the link here is that same link of the isolation monitoring procedures. That's a download. Any questions so far?
How do we handle it if the patient does not have an email address? We have a lot of elderly patients coming through that don't have emails.
That's a good question. As of now, we are sending communication via email. I don't know if there's other future enhancements for any other channels of communication. And we do have email address as required on the portal itself.
Yeah, they wouldn't, if it's required, they have to put something in there. So if they don't have an email address, they're not going to be able to finish the registration.
So how are we going to reach this population?
Can we put a message on the portal page that if you're unable to, if you don't have an email address, please contact and put a phone number?
Yeah, we could do that.
I don't know if that's, would that be like your current process?
Well, that's what
District
DC
4?
is doing with everyone. Everyone's calling a call center and they're entering them themselves because they had concerns like these types of things, and they also had concerns with how many people might register at once.
Yeah, and we also realize, you know, DC is a fraction of the population of Georgia too, so.
So
Okay.
the confirmation email, can we control when those go out? I guess my concern is our SPOC is open from 10 to 4. Instead of everybody showing up at 10 o'clock in the morning, we usually give them 10, 10:05, I mean, or 10, 10, 10, 10, 20, or, I mean, just trying to keep our flow in mind.
Yeah, I agree. We definitely need a scheduling component that's automated through this.
We have a follow-on for that to discuss the scheduling piece, but let's hold off on that. It's not available. We can discuss kind of what would be available next, and then what you want to have long-term. So I think let's hold off on that for our next call.
And I also just want to bring up the issue again that I feel like for our long-term use, this issue of us having to go in and approve them is going to be a deal breaker for us in epidemiology. And I think we need to, you know, discuss it with your legal team or something, figure out how we can get around that so that the system automatically makes the decision based on criteria that we define.
And your desire is an automatic qualification or rejection?
Yeah, I mean,
Correct.
You've already sorted it for us, and all we're doing is going in and clicking a button, but that's still an extra, you know, we're talking about hopefully expanding to be thousands of tests a day. And it's still, you know, just an unnecessary manpower step when we're already, you know, really strapped for manpower. So the purpose of this is
understand.
To take away the extra steps, not like give us something else we need to do. So I mean, to me, if you can't do that, this doesn't seem like a good solution to me. You know, I really think that we need to keep pushing that topic. And I know you gave us this quick fix, and I appreciate that because that will make it much more manageable to do the batches. But as we expand out beyond one site to, you know, really widespread testing, I think this is something that we're going to have to keep working through. And I'm sure there's some way around it, you know, through some agreement that we sign where we say we're doing the criteria and you're just implementing it. There must be some way we can address this with our legal teams to make this happen. I mean, the logic is already there. It's a simple step. And also, we need to be able to change the logic. You know, right now we've got the criteria we define, but we might want to loosen that as more come on board. So that's another thing that we'll need.
Okay. Anything else? Any questions you have of what I've gone over so far? Okay. If no other questions, I'm going to go back and reference the pilot workflow sheet. So we covered portal questionnaire, how to enter in new registrations, the fact that there's a QR code generated and sent out if there's an approved test. And we went through this process of the 2 views, selecting records, and running to flow to send out emails. So the next topic and section is on the Canvas app, and this is after the the email has been sent with the QR code and the patient individual arrives at the clinic, and how the app works at that point. So I'm going to demonstrate the app in just a minute, but just to go over these side bullet points here, there's a chance for the healthcare volunteer to enter in his or her name, and then using the QR code scanner on the app, he or she will scan the patient individual's either email or printout of the QR code that they received via email. If there is an issue with that, or they can't, the patient doesn't have the QR code, there's an option available to search by the patient individual's email. And if they were a totally non-registered individual that just showed up, there's an option to manually add the record as well. So let me go ahead and switch over to my phone. I hope this works. Let me stop sharing on my desktop and then try sharing on my phone. All right, slight lag, but are you guys able to see my app screen now? It says Department of Public Health.
Yep.
All right. So like I said, there's a field here to enter in the volunteer's name. And this is the part where you are able to scan the QR code or search, or top right, there's a plus button to add in a new record. So I'm gonna go ahead and scan the QR code email that I generated earlier. So this is where I'm gonna bring up my camera. And you can see here, I found my record that I entered into the portal. So this is all the information I added in. And what I'm gonna do now is link a test to the interview record. So let me go ahead and on my desktop, I know you guys can't see, but I'm bringing up a bunch of QR labels just for testing purposes. And I'm going to click on Add Specimen here. It's going to have the option to choose your specimen type. And then there's an option here to scan again. So this is going to bring up the camera again. So let me go ahead and scan one of these tests.
I'm going to need to add nasal swab to that.
I think I already did this
as well.
Okay. That will be noted. Okay, so I went and scanned the QR code. I'm going to click on Link Specimen. All right, so at this point, if I go back home, it should be totally linked. So I'm going to go ahead and stop sharing on the app. And I'm going to show you what that looks like in the dynamics. So let me see if I can stop sharing. Okay, and we're going to go ahead and reshare on my desktop. Okay, you should be able to see my desktop again. So I'm going to go ahead and choose that. I'm going to refresh my screen and choose that record that I created earlier. Okay, I'm going to go ahead and choose related here. I'm going to go to tests. And you can see here that I automatically linked the test I selected via the QR scanner in the app to the record I created from the portal earlier. So as you can see here, here's the test information, and then here is my interview specific ID, along with some details like my date of birth and full name, etc. Any questions on that process?
This is Amy from District 4. So we're in the process of learning about the new lab as well, the IPSM. So I'm just trying to make sure I understand. We're going to have to do all of this for the QR code or whatever, and we're going to be have this other set over here that we're doing with IPSM. Are y'all going to try to mold these together, or?
Right. So maybe I can address that. So there's a number of different lab initiatives going on. Ipsum is one of those. The purpose to which we were going to commit the Dynamics application to was to use lab capacity from the University of Georgia System Lab Consortium. So that includes 4 labs. Georgia Public Health Lab is part of that, as well as Augusta University, Emory, and Georgia State. And so the ideally, when this is finished and we're done, there's one place, one system, and we're able to route the test to the appropriate labs. So the testing that you would do at your Spock site, if we were to go live with this, would be entirely directed. You wouldn't be using Ipsum for that location. You would be using GPHL for that, for the purposes of the pilot. Does that help? So no, we're very cognizant. We don't want you to have to dance between. I mean, you're already dancing between multiple systems, and we're not trying to add one more. We're trying to. There's, it's just trying to figure out how to integrate this into what we're already doing without interrupting our production flow. And so, we're bringing Ipsum to every Spock site because we need to do something about the turnaround times with Quest and LabCorp. But no, I don't think if you go this way, you'll be ordering only from GPHL or the University of Georgia System Labs. You won't have to order from Ipsum as well.
Okay. Just so that I can provide my leadership with a timeline. So we get all this Ipsum stuff delivered late last night or early this morning.
Correct.
If District 4 is going to be the pilot, I mean, we're using Quest now. So can you give me a timeline? Because I don't want this staff at this spot to go from Quest to Ipsum for a day to this to this module. Does that make sense?
It does, absolutely, understood. And yeah, we're trying to figure out, part of looking at this demo is to bring us to that decision point on do we roll with this pilot, or do we have to come up with an alternate? So I can promise you a decision. I'm just not sure that we can answer it till later today. I think you can continue your current process with Quest, as long as you still have testing materials for Quest at this point?
Yes, and our plan was, after we got off the call yesterday, was to, because we know this takes time, to at least use Quest through Friday, and then we would maybe know where we're at.
Yes, that's correct. And so
okay.
we should be able to figure that out by tomorrow. Yeah.
Okay, that'll work.
Okay, thanks.
Any other questions so far? Okay, so we're gonna go back to the pilot plan over here and go through the next section here. So we just covered the Canvas app and went through all these different steps. The next one is really around the QR labels and details around printing them. So I'm not sure if we want to go through each one of these and just kind of talk through if there's still outstanding questions or open issues about these. But the plan right now is to have pre-printed QR labels available to put on the specimens. That is the GUID from Microsoft that I showed you earlier. That's on the QR code. It looks like there's some notes here for DPH. There's some open questions there.
Krista, did you want to talk to those pieces at all, kind of between the systematic steps?
No, actually. So I did want, this is for awareness across the board, but and these are examples of items that we're collecting. So I have a whole set of items like these where we're going to need to internally talk about what that looks like as we do roll this out, what items have to be addressed before true pilot, what items have to be addressed before true go live. And so, but there's no need to go through this right now. Some of these don't have long-term answers, right? And I don't want to slow us down.
Okay, sounds good.
Yep.
So going down here to L, this is the process I just showed you, where the clinician, medical professional will scan the collection QR, and that's then associated automatically to the interview record from the portal in Dynamics. So I'm going to skip the rest of these and go down to processing. And Dan, do you want to speak a little bit just about the file export, how that will work?
Yeah, sure. So we gave the export format where we could do, and for the near term and kind of how things that we can add after tomorrow. Looks like tomorrow we'll probably want to do what DC did and do a manual export and import. And so we have that functionality within the system, so I can actually show what that would look like. Okay, so we have a couple different views here. For the ones that we're going to export, you'd go down and select this view for test lab export, and we need to tweak the files this evening, to tweak the view this evening to show the other fields that you wanted that we can do now. Those I can show you briefly here. Let me pull it up. What that would look like. So we'll add the fields for, we have the record ID, the date of birth. We'd add first name, last name, gender. And so that's what we have the ability to export for tomorrow. Now, I know that there are other fields that you have to have in order to get it into the system. And so my suggestion would be, I think we talked about maybe hard coding that, and we'll just add the column here for what those additional fields are, right? And and then we could just paste in a standard number, like, I don't know if it's the order, let's call it the order, and we'll put in our account number, so some static account number, and we'll just simply paste that down. We'll save this as a CSV file, and then we'll work on, and then we'd have that imported into the lab system. Does that sound viable?
Hey, it's Brian from GT. Yeah, I think that would at least meet the kind of minimum bar for the pilot. And do you guys have that info already, or are you still waiting for it?
As far as what the static IDs and stuff are, I didn't see that come by, but I could have missed it. Did someone send that to me? Okay, so I don't think so. So let's make that a takeaway from this is, let's go, and I had sent the email with all the fields that you all requested and kind of what they were, and then you had responded, Brian had responded. Let's see, I'll pull that email up real quick here.
Yeah, I don't think you necessarily have to go through them. I'm sure you got it. We just need to make sure that you get someone from the DPH side can send Dan all the information he needs to put for that.
Yeah, we'll make sure you get it, Dan.
Okay. All right. Yeah, just a static value for each of the columns. Mm-hmm. All right, I'm gonna pull it up then. Yep. So that's how we do it, and then for as we move forward in the next week, we need to look at getting the SFTP capability in there, and kind of pre-populating these with a flow. We'll start working on that this evening and tomorrow as well. And then hope to have that early next week so that we can stop manually importing. What is the pilot plan for the weekend?
So this is Chris, and Carl or Tony can jump in, but I would kind of echo Carl's earlier statement of we're really still in a TBD.
Yeah.
We wanted to see this. We wanted to look at the workflow, and then kind of take that back and talk to our team, because again, we really don't want to go too soon if we still have things that we feel like we're going to have prior to pilot, and we want to make sure that our pilot team has everything that they need before we go to pilot. So we're still we don't have all the answers we need to make that decision.
Understood. Yeah, I'm just trying to determine what kind of support we might need over the weekend if you go forward with it, but we can wait on that until you have some discussions and think that through.
Yeah, I think there's a couple things that we do need to think about. So any information that Dan has requested, we need to get that as quickly as possible, because we do need to bring up the system in your prod environment so that you can generate labels. Even if you don't turn it on, don't publish the URLs, that's fine, but you're not going to be able to generate those labels for the pre-provisioning until we get that to that production environment. So my goal would be is to get to a point where we can do that tomorrow.
So the only one I've heard is the need for these the static values for this output file.
Yeah, there's one more coming, which is the list of users that would be in using the tool tomorrow or during the pilot. So, and then who would use it after that? But we can limit it to pilot now since things are sort of up in the air. And I'll give you a sheet with some column headings that you can fill out.
Yeah, because that's going to have to go to your IT group to get those actually up too.
They actually would like. How quick can we turn that around? Because your IT guy, we've been kind of monopolizing the two guys, and they'd like to leave at a reasonable hour today. I think is the plan. He did, give me his mobile number in a emergency that I could contact him later. But if we're gonna, I think we ought to at least get the list of users in case you do decide to go forward. If not, I would be working with him tomorrow to do it. And before we could get people set up, we'd have to go through that process of getting those users there.
So Dan, kick me that Excel file.
Okay.
And then I can start filling it out with who I know, and then distribute it for folks to QC it and add or remove as needed.
Okay, and it's gonna have some fields on here that you don't need to worry about. I really just need what's called the user principal name, and that's generally it's the same as their email address, but this would be like the ID that they'd log in with.
Okay.
And we'll take care of filling out the other stuff.
Got it.
So,
any idea how many that might be? Just so I can plan for it.
No, honestly, I'm gonna say, probably more than 10, less than 25, to give you a ballpark. But
okay, that's good. That's all. That helps.
So did thus end the demo?
There's one last.
The label printing. Oh, go ahead, Andrew.
There's a couple of things. So one is, even though we're still trying to figure out exactly how to ingest the test results, we do have a process in place once the test result is updated that automatically sends an email to the associated individual's interview record, and then that individual is then able to click on a link to view the results online. So I can show that after this, and then we can go on to the QR codes.
Sorry, Andrew. This is Brian. Did you say that you don't have a way to to ingest a results file? I thought there was a CSV file with a defined template.
Yeah.
No,
I'm going to give you the file that you'll populate back from the lab that we'll ingest.
Yep.
Yeah, I guess I meant, sorry, I misspoke. I meant in terms of setting up the SFTP so far.
Oh, I
got you. Trying to figure out those details. Yep. So Dan, if you want to let me share again, I can just go ahead and show the test results.
Go ahead.
And then if you want to show the QR codes, or I can, either way. Okay, so if you guys can see my screen again, I'm going to go ahead and open up the the test again that I'm going to refresh just to be safe, that I associated earlier. So I'm just going to go ahead and manually update this test result. But like we were talking about earlier, this will be automatic. And then I'm going to go ahead and save the record. And then we have a process in place that will send out an email to the associated interview individual. So it's going to send out to me since my interview is associated with this test. It's going to give them a link that they can then click on to see their test result. So let me go ahead and refresh my email.
So is the patient going to be getting the result at the same time as public health?
So yeah, so the patient will get the email out of Dynamics. I'm not sure exactly the timing of when public health would get it. I'm assuming whether that would be, before it's ingested in Dynamics or just someone going in here and looking at results.
Yeah, I think from the Dynamics perspective, when the file is provisioned to us to consume, then the emails will generate, correct?
Yes.
So the control is really when you decide to push them into our system.
Yeah, so if you need some sort of qualification or validation prior to that, that would need to happen before it's ingested.
So, but the patient results are available within the tool. So the moment you send the email, they're also able to look up a record to identify, the results of the test. Is that not correct?
Correct. Yep.
Oh, okay. So it's available at the same time essentially, and then we also will have the pathway from GPHL to the case reporting process as it stands right now. So there will be more than one pathway by which the results will move. But no, you shouldn't be in a position where the patient knows something that you don't. If that makes sense, you should have access to that same information the same as the patient does.
Correct. So let me go ahead and click on this link.
And how is this going to work if there are multiple people with a single email address? Is that possible? So say a parent and a child.
So in that case, if they're entering in their information through the portal, if they were separate registrants, they would, not sure if there's any checks on the email address for duplicate records, but essentially they would have two different records and then two different tests. And then, those would be updated accordingly so every email that's sent out with a link to the test result has that unique ID on it. So they would have different results, if that's what you're wondering.
Yeah, and everybody
validation, right?
Yeah, birth date validation. So I'm gonna go ahead and choose birthday, click next, and then they're gonna get a message here with their results, date of birth, and if we had a date on here, they would have the date as well. It's a pretty straightforward process from once the results come in to the individual getting notified to them being able to self-sufficiently click on a link to view the results. Any questions on that? All right. Dan, do you want to show the QR functionality or you want me to? What do you want to show on that specifically?
Oh, to generate the QR codes for the files?
Just to generate them?
Yeah, I can do it.
And while you're loading that up, the other thing to note is on the team site for the project, We've also published all of these, the scripts that go with the testing. And there's a tab up at the top that gives you an index to all the documents around this testing.
And this might be a Carl question, but how are we getting the data into our current system? Are we waiting for it to come through ELR from our lab, or are we going to be doing an upload directly into SENS with the results?
So for the pilot and for the testing that's going to be happening at GPHL, our plan right now is to use the existing ELR route to move that data in. We could definitely build something off of the ingest that goes into Dynamics as well. And so if the timing is a question, we still have to work out with the lab, would they follow the same resulting process where those results, go through and are, pushed back to Dynamics when the final report's generated, which is the same process that happens right now for SENS, in which case the two might occur at the same time rather than one occurring sooner. And so I think I know right now we have the positive telephone notification or the daily flow sheet that is getting sent from GPHL to Epi, and I don't think any of those things change necessarily. It's the but yeah, as far as the patient notification goes, we should peg it to what we're doing so that, that the ELR has the same opportunity to go.
Yeah, because I know we'll want to capture the additional information in the system, the work and exposure variables and the pre-existing conditions that we don't get, and ethnicity and stuff like that we don't get through ELR. And I guess, will there be a way for us to know in the short term if it's coming over in ELR that it went through the system, because our notification processes would be different for this?
That's an excellent point, and we should be able to identify that, but we need to confirm that it doesn't appear the same. I mean, and that's something we can negotiate with Tanya to figure out how these get marked as they go through the Apollo flow. But that's absolutely an important point. And it may be something too where we look at the same file that goes over to Apollo that represents the order, that we ingest that same file into SENS and create a placeholder so that we can look for those specific tests when they come back and match that order to that result, and we could know that way as well.
Okay, and that record that's going over to Apollo, even if Apollo is not using it, would contain all the variables in the data set?
Well, that's a whole nother can of worms that we have to get to. And you're referring to the answers to the screening questions, yes? Yeah,
because we'll need those for our case reports.
Yeah, and my understanding is from Dynamics that we should have the ability to pull reporting information, and so we would probably have to have a process to connect all that back.
Oh.
Yeah.
Now, the screening questions, you want that pulled at the same time that we schedule the test, is that right?
What we're saying is that the screening questions are important data about the patient. We need to understand the circumstances as best we can of what their infection is. And so if somebody tests positive, we want to know were they a healthcare worker? So that's useful information to structure how we interact with that person after we've identified that they're positive. And what we're trying to do is figure out what's the most efficient way for that information flow, rather than having to go and pull somebody up in our case reporting system, conduct the interview at the same time, pull them up in Dynamics, and look at it that way. And so that's
I got you. So Rhett, which tool are you going to use and we're going to do it? I mean, we have dashboards, we can create other ones, but obviously if you don't want to use this tool, you want another tool. We're going to have the ability you'll be able to tie this data that's in CDS into other systems if you want, as well as build your own Power BI, analytics and reporting solution. If you want, but that's just down. But the question is, can you do sooner? how do you handle what, what do you have to use in the near term versus how do you want it long term?
Well, it's so when we're doing a case follow-up, we're talking to an individual on the phone, and we have data that's a part of that encounter, and we need to make sure that whoever's doing that call understands the context as best they can, who they're talking to and what situation, so that they can be as efficient. And so that means that as we're doing these follow-ups, we would want to not have to go into two systems to just get what they answered for those screening questions. This is really, I think, what it comes down to.
Yeah, I mean, the simple near-term way is you give them a license, they use this application here, and then go in and search and look that person up.
Yeah, but not when we have hundreds of cases. To do that becomes really difficult. So currently we have all of that data up front in our system. So when we get the positive result, we already have that data in there. The positive laboratory result is linked to that patient record, and then we conduct follow-up from an epidemiological standpoint. And we already have all of that information in there. So it would become very difficult to have to go into two systems to pull that information after we get the result.
So you need to get the additional interview questions into your other system, ideally, so that you can still use that.
And I would assume that would be some sort of reporting capability that we could generate and ingest into our system and connect it back to everything else that we have on that particular person.
Yeah, so how do we do it in the short term is going to be the question.
Are those fields not available from the reporting tool? I mean, can we just not design a report and export it to a file?
And just keep exporting stuff and importing. Yeah, I mean, we can. Yeah, certainly.
Okay. It's not ideal. An automated way to do it would be much better, but at least it's not there is an electronic way to do it.
Yeah. That's definitely something to solve quickly. You don't want to be importing and exporting manually for weeks on end, right? So, and kind of the plan would be like that we'll be there working with you so that to teach you how to export, to teach you how to change these views, and during the, tomorrow or Monday, whenever, the need is. And then, once you have people that know how to do it, you can train your other staff.
Well, I mean, we're talking there like a batch export, not an individual export, right?
Yeah, I mean, we're already doing a manual import to the lab as far as moving the data over. And so this would be a second step to pull out the screening data report at the same time that order goes to the lab. And then we ingest the screening data directly into SENS. We ingest the lab data into Apollo. The test gets performed. And then when that result is communicated back, we connect that screening data back to the ELR. I mean, yeah, no, none of that's ideal. All of that should be automatable, but it's not. And so, that's a way to achieve that, at least short term, until we can figure out how to automate that.
Yeah, and then there's lots of ways we can do, an automated integration for it as well. We could use a similar type of thing. I don't know how, it all depends on, do you need this real time? What's sort of the latency you can have? And that will kind of determine what's the best way to do it. I mean, the idea that we have now, we're dumping the file and then you're picking it up. That would be really our easiest next step to get the lab to the tests exported and imported in an automated way, and then get the results back. And then we could also, you could use the same pattern in order to get that additional data and do something with that as well.
Correct.
I mean, I think the ideal thing for integrating it into our current case system is if we just get all those data on the positives, that we don't actually need to have all that data in our system on the negatives, unless anybody feels differently.
No, right. I think we do it at the time of order, though, because that's when the data is available. And so what we do is we park it, and then when the result comes back positive, we pick up that data from Dynamics and we carry it with the positive, and that goes into the PUI and the case report. And so we would just need to map these screening questions to their appropriate places within the either the PUI or the case report or both, and then I think you would have it. So it you know, hopefully this would be seamless to you all. You know, it does require a second part of the process, but I think, you know, we're doing it manually to get the things tested. It would be no big deal to add a second step to get the epi data out and pushed over, and then the two come back together when the results come in. So it wouldn't create PUIs or risk information on the negatives. We would just do that when there was a positive result.
That'll work.
Okay.
I guess one other question I have, just, and I don't know if this is the time to bring it up, is that if we're really piloting this tomorrow, what are we doing about scheduling? Because this changes the existing workflow. And I don't know if District 4, if you guys have any thoughts about, now that you've seen the system, you know, what might work for you based on your current process of scheduling.
So we have that scheduling discussion come up in 5 minutes. So is it the exact same team?
I'll take it then.
It's not all the same team, Dan, but there are some overlap.
Okay.
Yeah, unfortunately, we are still going to need to. We should drop and rejoin the other one. Yeah.
Yeah.
I mean, for scheduling for District 4, or, I mean, so I guess I need clarification. We're trying to use this tomorrow.
So right now, I don't think that's viable. I think what needs to happen is Microsoft needs to get through this, release the application to us to have it available, and then we need to be able to walk through it as it's delivered, and make the decision at that point. You know, do we agree that this is workable? And I don't think we can do that until